Hello, this is Miss Roberts. We are going to go over Chapter 14. This is developmentally appropriate nursing care across care settings. It's still the ages and stages. Okay, so we're going to start on page 457. So this is just talking about reasons for medical attention. Each year children end up in the ER, of course, but the major cause of fatalities are head and neck injuries resulting from bicycle and motor vehicle accidents. Okay, that's a wink and a lollipop. Major issues are due from bicycle and vehicle accidents. Okay. You have a table 14.1 below. It's also over here on the side according to age groups. So the number one reason in infancy has to do with motor vehicle accidents because of improperly installed car seats. Wink and lollipop. Make sure you understand that. So when we are at the hospital, maybe the patient gets discharged and we take them out of the hospital, we cannot, by law, according to the hospital policies, we cannot install a car seat because we will be held liable for that if something were to happen. If the family has questions on how to install a car seat, then they are to go to the fire department or the police department, sheriff's department, and they'll be glad to help them. But as nursing staff, especially nursing students, we cannot install a car seat. Okay. For a toddler, and the same reason, the biggest reason of non-fatal injuries is motor vehicle accidents. Okay, you need to teach appropriate use of car seat restraints to all of these age groups, to the parents. Make sure that that's a priority teaching. Wink and lollipop. So you might want to write that in your book. Teach appropriate use of car seat restraints. Okay. On page 458, it starts talking about atraumatic care of the pediatric patient. It's family-centered care, gives you a definition of that. And then it starts talking about separation anxiety. So, separation from the parent causes the child extreme anxiety when they're hospitalized. So we always encourage the parents to stay with the child. Hopefully they will, and but especially if you remember the chapter 13, that starts about 9 months, and we don't want that to continue, so we encourage the parents to stay. Another wink and lollipop is parental presence has been shown to help the child cope with the hospitalization. Wink and lollipop. Alright. This talks about establishing relationships with the patient and the family, nursing insight, and then asking some questions. Okay. And this is just pictures of family members and the hospital, nursing staff, doctors, whoever they are, with their families. There is an acronym called Old CARTS that I've used when I was in NP school. We would do OSCEs, and this was just something to help you remember when you're assessing. So it would be really good for you to know. The old CAT is in your book. There's an old CART too. So when you're assessing a patient and you write old CART at the top of your sheet when you walk in the room, you won't forget what to ask. So onset, location, duration, characteristic, alleviating and aggravating factors, radiating and relieving factors, timing and severity. That way when you go back out to chart, you know exactly what to chart because you have received all this information. Always ask open-ended questions. It's very important to ask open-ended questions. This is another winking lollipop. And for some reason it's not letting me highlight. Let's see. Let's go back. Here we go. So winking lollipop, make sure they're open-ended questions, okay? How can I help you today? What made you come in today? Not yes or no questions, okay? You're going to get more out of the open-ended questions. That was on page 459. Then it starts talking about past medical history, social history. So teenagers, you know, asking them, do you drink? Do you smoke? Do you vape? Any kind of drug use? Do you drink alcohol? Do you drink energy drinks is even a good one. Are you sexually active? Do you practice safe sex? If they don't feel comfortable asking all of these things in front of their parents, you can always ask them, the parents, for consent to talk to them alone. So then it starts talking about nutrition, immunizations, and nutrition. Sleep patterns, patterns of daily activities. Okay, so you have the SOTA acronym. And this is sleep, output, diet, and activity. Okay, and then nutrition. Another big one is with breast milk, of course, they should have 6 to 8 wet diapers a day, 6 or more wet diapers a day. For an infant, we want them to have 1 to 2 bowel movements or 6 to 8 wet diapers a day. Then on page 461, it starts talking about the caloric intake for each child up here. What should they be eating? How much should they be eating? And then you have your health assessment, okay? So as a guideline, we always start with the least invasive activity first. So, you know, if you're assessing a 2-year-old, you're not going to start sticking an otoscope or temp probe in their ear first because they're going to get mad, and then how are you going to hear them listen to their heart and lungs, okay? You always start with the least invasive first, okay? This is a winking lollipop. The length, of course, shows you how to measure a baby. Make sure that you are remembering that. So you mark. You can mark the paper on the table, or you can mark it. You know, mark and lay them down. But you always stop at the heel, the top of the head, the crown of the head, until you get to the heel. For older children, you would use the stadiometer, and then flip the little bar down. For the weight, weighing an infant, you're covering it with a thin paper cover, and then balance it to 0 before you sit the baby on the scale. Make sure it's at 0, okay? Whether they're sitting or supine, doesn't matter. Vital signs. Make sure you read through this, and where it says, and this is the same picture over here, pulse. Where do we listen to a pulse on an infant or a child? Apical pulse. Always the apical pulse, okay? You count for 1 full minute, right? You remember me talking about that? If you've never assessed a patient before, whether it's a newborn or a 99-year-old, if you've never assessed that patient before, you need to get their apical pulse for 1 full minute, because you need to note any arrhythmias, any murmurs. If you see this patient every day, then that may be something different that you can do 15 times 4. But if you've never assessed a patient before, and the first time you listen to them, or the first few times you listen to them, you always need to get an apical pulse for 1 full minute. This is our average vital signs. You can just read through those and be familiar with them. Skin assessment. So, I know we've talked about acrocyanosis in a newborn, but cyanosis in a child may indicate some type of compromised cardiorespiratory issue, okay? For some reason, the oxygen is not flowing to the peripheral system appropriately. Particular lesions may indicate infection or blood disorder, so wink and lollipop, make sure you understand this, and make a note to always check the blood pressure and the pulse with this state of condition. Head assessment. So we talked about the anterior and posterior fontanelles. So although there's six fontanelles, of course, you have the most common ones, and that's the anterior and posterior, okay? You need to know these numbers, wink and lollipop. The posterior fontanelle closes within 1 to 3 months after birth, and the anterior fontanelle remains open until 12 to 18 months. So posterior closes 1 to 3 months, anterior 12 to 18 months. Wink and lollipop. Visual acuity screening. So make sure you read through this. They should not be squinting their eyes when they're trying to read a chart. Okay, we use the Snellen chart, and I will show you that in class. This is anterior and posterior fontanelles, of course, we talked about. But this is the Snellen chart. If they can only read this E, these numbers over here indicate that a normal person with 20/20 vision can see this E at 200 feet away, whereas somebody with 2200 vision has to look at it only 20 feet away. Okay, I know that sounds backwards, but it's not. This one, what a normal person with perfect vision can see at 20 feet, this F and P, 100 feet, person with 2100 vision would have to be only 20 feet away from them. Okay, so next one. This person can stand 70 feet away, a normal person with 20/20. They can stand 70 feet away and see this TOZ. But somebody with bad vision, 20/70 vision, would have to be 20 feet away from them. Okay, and it goes down. So you would do the right eye, the left eye, and then both eyes. With and without their glasses or contacts. Okay, what do you think the green and the red markers are on here for? So that's on there for color blindness. Okay, can they see that this is a green line? Can they see that this is a red line? So don't say, can you see a green line? You know, you point to this line and you ask them, what color do you see? And then you point to this one, what color do you see? Okay? We will practice this in class. Focus on safety, use of an otoscope. So the general rule is to pull the pinna down and back for younger than 3. This is also in your ATI book. So down and back for younger than 3, and up and back for anyone over the ages of 3. Okay? So down and back, younger than 3, up and back, older than 3. This is when you give otic drops as well. This is a wink and lollipop. So now we're going to talk about a child in pain. How do we note a child in pain? You know, they don't know what the numbers mean sometimes if they're not old enough. So on page 468 in your book, it talks about a child that's in pain and the pain scales that we use. Okay. So these are the pain scales over here. We have FACES, the Wong-Baker FACES pain rating scale. And then we have the numeric for anyone over the age of 12. Okay, so 0 is no pain, 10 is like getting your leg cut off. Okay. So understand the FACES is school age, preschool through school age, the FACES. And the numeric is anyone older than the age of 12. Alright, so this is another wink and lollipop. So in infants and children who cannot self-report, we're going to use the FLAC pain scale. Okay. Faces, legs, activity, cry, consolability. That's what that stands for. So right here. Okay. Kind of watching their grimace. Alright, genetic disorder, and this is the FLAC pain scale right here. Okay, so the FACES, and then the FLAC is this one down here. So the FACES, legs, activity, cry, consolability, and this is for, you know, smaller babies that can't point to a face. Okay, so you have the FLAC for like infants, small children, then you have the FACES for preschool and school age. And then you have the numeric for anybody older than 12. Okay. Narcan. This is just a little focus on safety. You know, Narcan's available at the health department. You can get it for free. Go in there and get some. It's not a bad idea for everybody to have some Narcan on them with the fentanyl epidemic right now. Table 4.7. is talking about the child with disabilities, genetic disorders, understanding the emotional concerns, developmental concerns. So I just want you to read through this, okay? Cystic fibrosis, you have this infancy failure to thrive. Of course, they're born with that. Sometimes it's caused from traumatic birth. Sometimes it's caused from a stroke in utero. There's multiple reasons. This is just pictures of parents being with their children while they're in the hospital. Across care settings, read through this, and then decrease stress of hospitalization. So we talked about this already, but you know, saying another wink and lollipop to help a child adapt. We always suggest the parent room's in, right? They need to stay day and night. You know, if kids are scared of the dark, and you know, if their parents are leaving when the sun goes down, that's just going to make things a million times worse. So anxiety is that reaction for a child, so we just encourage them by all means. If they can't stay, get a grandma or aunt or uncle, somebody else to stay. Okay, so wink and lollipop there. And then we have this chart. Of course, Erickson, my favorite guy, in his developmental task. Okay, so make sure you read through all of these. Encourage patients to stay for infancy. Encourage them to bring familiar items like toys and blankets from home. Preschool, encourage the parents to stay with them, encourage them to bring items from home. Okay, for preschool, also, this wink and lollipop, you want to explain the procedure. Okay, explain the procedure in a way that child can understand it, because you know they can start understanding some things, and you don't want to just exclude them because of their age. So you know, demonstrating putting a Band-Aid on a baby doll, or you know, that kind of thing. Perform procedures as quickly as possible with these. Okay, you want to do therapeutic play, offer praise, encourage a safe environment, let them go to a playroom or bring toys into their room. A lot of hospitals have toy rooms, and we're going to do an activity in class that has to deal with that. Therapeutic play. So let's talk about that. This is just kind of demonstrating to the kid what's going to happen. Okay, so a needleless syringe filled with water, get a baby doll and an alcohol prep, and kind of let them give the baby doll a shot. Okay, if they want to put a Band-Aid on their baby doll, let them put a Band-Aid on their baby doll. Okay. Let's see. So after the injection, the nurse can provide a bandage or a sticker for the reward. If they come in, for themselves and they think they have a boo-boo on their arm and you don't see any mark, you don't see a scratch, you don't see a bruise, you don't see anything, give them a Band-Aid. I mean, if it makes them feel better, then give them a Band-Aid. They probably want it because it's got bluey on it or something. I don't know, but just give them a Band-Aid. It's not going to hurt them. Okay, wink and lollipop. Let them put a Band-Aid on themselves or provide a bandage for them. Okay. Medication administrations talks about over here. Of course, the same medication rights. Okay. Medication, patient time, route, dose, and approach. So, and then 474 starts talking about holistic care for the child. The bathing, feeding, rest. Goes on to page 475. Safety measures. So let's talk about some safety measures. This is on page 475. Okay, identify their children, of course, with their armbands, right? They're no different than anybody else. So identify them with their name bands and asking them where they are. Do they know where they are? The orientation check. And then you're going to verify that, of course, with the medicine too. Those bands are easy to fall off, so make sure you put them on well enough that it's not too tight, but where they can't fall off. And just some more conversion stuff, dosage calculations, medication administration. They have all the bubblegum flavored and cotton candy flavored and all that you can add to the medicines, and a lot of P's units request that from the pharmacy where they can make the medicine more tolerable for the child. And then there's on page 477, it's talking about the dosage for acetaminophen. So 0 to 4, it's 10 to 15 milligrams per kilogram dose every 6 to 8 hours. So just read through this. You don't have to memorize it, but just read through that, okay? And then, of course, we alternate acetaminophen with ibuprofen for children, giving Tylenol every 4 hours, ibuprofen every 6 hours, and then that calculates out that they may get both of them at the same time, and that's okay. But we need to, keep a fever down, or if they have influenza or whatever, just you can rotate those. Alright, preparing children for a procedure on page 478. So, just talking with them, talking to the parents, because a lot of times the parents are nervous as well, right? Let the child know it's okay to cry. Let them, do the therapeutic play where you let them perform the procedure on a teddy bear or baby doll. It's okay. And then preparing the school-age child for a procedure. Make sure you read through this. Make sure you understand what an informed consent is. Make sure you have that, or you're practicing against the law. So, Common procedures, of course, are IVs, right? This is on page 480. Peripheral IVs, access ports, PICC lines, infuser ports. All of these are common. Of course, the peripheral is the most common. Urine specimen collection. So we all should know that how do you collect a clean calf, right? With babies, you have to use the U bags, right? Over the urethra, and whether it's a male or a female, that's where it goes. But for an older child, you can tell, if they have enough control to pee, and then kind of squeeze it to stop peeing, and then pee on in the cup. And you can help them wipe front to back with the wipes, or their parents can. Fluid maintenance requirements are on this page as well. You'll see that up here. Enteral tube feedings. Of course, throat cultures are mentioned. Enteral tube feedings, make sure you read through this. Focus on safety, like an OG or NG tube is on here, and how we place those. So we know we start where? Tip of the nose to the ear, down to right past the xiphoid process is how we measure to place the NG tube. For OG, mouth, nose, xiphoid, okay? So I just say halfway between the xiphoid and umbilicus, right? And that's where we place it. There's a picture of that as well. Then your ostomy bags. You change these just like you would an adult. You make sure you're clean gloves and clean that site, the ostomy site. 486 is talking about community settings. It mentions chlorohydrate in there, which is ultrachloral. It's a sedative. You can read through that if you want to. And these are elbow restraints. A lot of times we'll use these when babies and small toddlers have IVs, where they can't pull those lines out, okay? Then there's some information under community settings, toddler safety. So let's look at this one. Prevent poisons, okay? Keep those cabinets locked up. Teach your parents to always, always, always keep chemicals, any kind of toxins in drawers that are locked on top shelves of cabinets where they can't be reached. And they need to memorize this poison control number, 1-800-222-1222. You as a nurse should have that memorized. School-age children, same thing. Keep them out of reach, okay? Keep them away from the children. And keep that number handy. 1-800-222-1222. And for adolescents, of course, we're going to talk, just like I mentioned a while ago, we're going to talk about all of these things, okay? Alcohol, sex, firearm safety, okay? Ask them, if there's firearms in the house, have you been trained on how to use a firearm? Do you know about the safety of firearms, okay? We'll talk more about that when we get to the psychosocial chapter. Lack of wearing seatbelts. It's so important that they put their seatbelt on absolutely every single trip. I don't care if they're going a mile down the road. Accidents happen. And a lot of them happen close to home, okay? Are they eating healthy? Are they exercising? All of these questions should be asked. Talk about vaping. Talk about smokeless tobacco. Some schools in our area have like smoke detectors, but they're vape detectors in the bathroom now, which is a wonderful thing. It's a proven carcinogenic, and we don't want them having access to that. Care in the school-based settings. Let's talk about that. This talks about the community, school-based settings. Let's see. Completing screenings. Okay, so usually about middle school they start doing some screenings for scoliosis, right? And we'll demonstrate this in class, but there's the e-cigarettes, of course. But types of scoliosis. So the healthy spine is straight, of course. You have thoracic scoliosis, which is including the thoracic spine. Then you have lumbar, including the lumbar. Thoracolumbar, which are both, and then a combined scoliosis. I remember getting tested in the 7th grade and walked in a room, and if you walked out with a yellow piece of paper, that means you needed to be treated for scoliosis. And of course I walked out with a yellow piece of paper. Had to go to physical therapy, go see an orthopedist. So embarrassing. So I hope that school systems are not still doing it like that. But I will demonstrate. It's a very easy check, very easy skill. So just to review school-age children, bicycle safety, major cause is bicycle-related fatalities because of head injury. So that's why bicycle helmets are so important. Remember, smokeless tobacco is a carcinogenic. Number one prevention for parents of toddlers is what? Appropriately installed car seat. Okay? All right, that is the end of chapter 14.